We can now bring in Thomas Gift, Professor of Political Science at University College London. Thank you very much for joining us here on France 24. Now, we saw that the coronavirus was sort of politicized in the United States under previous President Donald Trump. When it comes to who gets the vaccine, is that what you're seeing as well?
Oh, of course. I mean, this has been one of the most politicized issue in America over the last year or so. And by and large, it splits down largely along kind of partisan lines. And so liberals are much more likely to obtain the vaccine. Republicans are much more vaccine reluctant. And so this has been one of the big challenges for the Biden administration, that he's trying to convince a good portion of Americans that actually getting their vaccine is a civic duty, particularly with the Delta variant and all the challenges that we're seeing there. It does showcase really the imperative of this issue, but that's going to be hard, bringing those inoculation rates up to a significant degree simply because this is so partisan.
And because whoever wanted to get a vaccine by now would have gotten one by now. But what can states do to incentivize people to go out and get vaccinated? I mean, we've seen states give out cash, beers, donuts, what have you.
Exactly. I mean, they're kind of throwing everything in the kitchen sink at this problem. I've even seen some lotteries as well. So it's very difficult, though, I think, for states to do any more than they already are. I mean, in large part, what they can do is provide the infrastructure, enable a set of vaccine distribution venues, but then ultimately it's up to Americans to go to those venues. And so this has been part of the larger public campaign at the state level as well as at the federal level to ensure that people get vaccines who are eligible to have them. That's basically all Americans at this point. But, we did see that Biden missed this 70% goal on July 4th of having all of the nation's adults receive at least one jab. But that's largely a demand issue and not a supply issue. The supply is there. It's really about convincing Americans to go out and get the vaccine.
I know you said there's hesitancy along party lines among Republicans, of course, but also among certain minority groups, notably African Americans.
Exactly. I mean, this does cut along some of those lines as well, and it kind of goes to some of the history associated with these issues. But by and large, I would say that the primary individuals who are vaccine reluctant are Republicans, and in particular, Trump supporters. So it's a diverse group. There's variation. And I think the challenge for Democrats is not to simply dismiss those or criticize those who aren't going to get the vaccine, but to meet them where they are, to essentially provide a message that's more persuasive. I think ultimately that's going to be more effective at reaching the people you want to reach rather than just saying, well, I can't believe you're not getting the vaccine.
One of the things authorities here in France are toying with is potentially making vaccines mandatory for healthcare workers by September if they don't take it themselves. Could that be something the administration toys with, making certain professions, making it mandatory for certain professions to get vaccinated?
So it's possible that's part of the discussion. I haven't seen that explicitly. I mean, I think in the United States, there's a real reluctance to go down the path of trying to force people to get a vaccine. It just kind of cuts across some of the cultural dimensions that are present in the United States. So I think ultimately, that's going to affect a sizable number, but relatively small. The big chunk of people that they need to get is about kind of driving up demand and convincing them that this is safe, that it's effective, and also that, it's one thing to say you want to take the risk for not getting a vaccine, but what you're doing by not getting it is putting others at risk, those in your community. And so that's what I think this administration is really trying to drive home.
I understand your point because, in the U.S., it was one of the only countries in the Western world where we didn't see a blanket sort of shutdown of the system like we did here in Europe or even in the U.K., where you are.
Exactly. I mean, this goes back really to the United States federal system, that so many of these decisions are relegated to states and in some cases localities. So it's hard to have a federal approach. I mean, the United States government can kind of do what it can to set the framework, also to establish guidelines, but it's up to individual governors to make these decisions. And then it's up to individual citizens and Americans as to whether or not they're going to follow them. So this is an issue that has been going on for quite some time.
Okay, Thomas Gift, we're going to leave it there. Thank you very much for joining us on the program today.
Thank you.